Welcome back, continuing the news. In this evening's health report, Shamela Pullen looks at the benefits of minimally invasive surgery.
Minimally invasive surgery, also known as laparoscopic surgery, uses smaller incisions to perform surgical procedures when compared to traditional open surgery, which requires larger incisions. Medical Chief of Staff at the University Hospital of the West Indies and consultant neurosurgeon Dr. Carl Bruce says this approach offers several benefits.
Most of these patients would have required open surgery and would be in an intensive care unit for quite a few days. With the interventional suite, many of these have turned into what we call day case, or next day they are home with minimal to little ICU time needed.
Other benefits include less tissue damage and trauma, reduced risk of infection and bleeding, less post-operative pain and discomfort, faster recovery times, and smaller scars. But minimally invasive surgery is only suitable for certain medical conditions.
While we're highlighting stroke and cerebrovascular disease, cerebral aneurysms that can rupture and bleed, arteriovenous malformation, and abnormal tangle of arches and veins that can rupture and bleed. The interventional suite also does a lot of patients who need cardiac stenting. So Jamaicans say a heart attack, or the doctors will say a myocardial infarction. So when those vessels close off and the heart is not getting enough blood, we do balloon for the coronary vessels and stenting.
The cost varies depending on one's condition. However, Dr. Bruce says the UHWI is working with other groups to provide care for those who can't afford it.
You will need access through the blood vessel, as well as catheters that go up into your aorta, your heart, your brain, etc. So what we have done is that we have tried to work, as I said, with the NHF and the Chase Fund, so that you can get many of these disposables, we call them, at a negotiated price. So rather than the hospital and the NHF and all of the folks buying individual, what we've tried to do is see if we can get the best prices that are available worthwhile for a group of patients.
With your health report, I'm Shamela Pullen, wishing you good health.